Today I'm going to be talking about pregnancy and postpartum and how it is that I got into offering care for these different phases of life. And really my interest in pelvic health started with what I believe is a really basic realization. The realization that all of humanity is brought into existence through the pelvis, and that to me is major. There's a lot of power in the pelvis. If the genetic material is stored in the pelvis, and it's through connection of the pelvis and then birthing through the pelvis, that to me, from the metaphysical, energetic, spiritual perspective, there's a lot of power in the pelvis. And as a doctor of physical therapy and studying different muscles, the muscles around the pelvis are huge drivers in our performance and our power and our stability. So it's always been an interest of mine to understand the pelvis on a deeper level, and through physical therapy you can become what's called a pelvic floor physical therapist, where you go on to receive additional training in how to assess and evaluate and treat the muscles of the pelvic floor, which are the muscles that are at the base of the pelvis. They run from the pubic bone to the sacrum, and so with people's consent, those can be evaluated and assessed and treated externally and internally. But before that, I had this realization with the pelvis, and I'm also a yoga instructor, so through yogic philosophy there is the understanding of energy centers, and one of the energy centers, or vortex of energies, which are referred to as chakras in Sanskrit, is located at the sacrum, at the pelvis, at the area that I already felt there was a lot of power in. And so when you look at the chakras, there will always be an anatomical, physical, bodily region associated with each energy center, and then there also will be life themes associated with them. And so I found it super fascinating that the sacral chakra is associated with sexuality and fluidity and creativity. For a long time I didn't understand why creativity was associated with it, until that realization kicked in of how powerful the pelvis is, because it is the area through which we bring forward new life with. And it started to make sense of like, oh yeah, if you weren't bringing forth like physical life as in a new child or a baby, then there's that energy there to create. The energy that exists there is to innovate and to bring forth new ideas, to birth things that have never existed before. So I find that super fascinating, and one of my first jobs out of physical therapy school was actually at a pelvic health clinic, a women's health clinic. And so I quickly realized, you can't call yourself a pelvic health specialist if you don't fully understand conception, birth, pregnancy, and the postpartum phase. So I made it a really big point, explored things from my own cultural perspective in Puerto Rican culture and Mexican culture, and there's a lot of ways that the community was just oriented to knowing how to care for someone postpartum and knowing how to offer care for people that are pregnant. And it's just really, really fascinating to see the difference of how somebody is cared for in a traditional way versus how someone is cared through a more modern medical system. And so the U.S. really established the OBGYN profession through the development of the cesarean surgical intervention, which was a intervention that has a really dark history to it because of how women who were enslaved were experimented on to develop the surgery. and to develop certain techniques. And then when the surgery was offered on a more public level, there was a lot of propaganda around what was safe and what wasn't safe, and creating fear around home birth to promote this transition of bringing people into the hospital and giving them the option for surgical interventions and painting a picture that it was safer. And I'm all about innovation, and I'm all about new ideas. That's how I started this video, was explaining how it is that I came to value the pelvis. And so I'm all for innovation and new ideas, but I just saw how it came at the expense of discrediting and devaluing a lot of the care that was provided traditionally through the midwife. And so midwives, since the beginning of time, have had very sophisticated postpartum protocols, which there's just been a straying away from that. In an OBGYN model, there is not a very strong postpartum protocol. Your experience with an OBGYN model is, we'll see you in 6 weeks, and a lot of people, I feel like, are hoping and waiting that something else is going to be delivered in terms of care at the 6th week, and it's just typically like, you're good, you're cleared for penetration. And so there's a lot of people that are disillusioned and disappointed with that model of care. I saw that, I see that. I ask people, when did your pain start? When I was pregnant. When did your sciatica start? When I gave birth, when I was postpartum, how long ago was that? 6 years, 12 years, 20 years? And I just started asking very basic questions, like, why is care not being delivered sooner for these? There's a lot that the body goes through during pregnancy and postpartum from a physical perspective, let alone emotional and spiritual transformations and realizations and insights that need space to be processed. But the physical body has to be rehabilitated. And so I saw what was lacking in modern medicine, but also, respected that there's a lot of innovation and interventions available, and somebody marries the understanding that surgical interventions can be an outcome and maybe a preference, and as can certain medications and pharmaceuticals and other interventions that are associated with birth. But I think that so many people are seeking deeper care, and just knowing that that's existed since the beginning of humanity, and it's just a matter of reconnecting with it. And so I have that expertise. I've been blessed to be able to study and learn from what I call the original birth keepers. Birth keepers and birth work is a term used to collectively describe somebody whose understanding is around conception, pregnancy, birth, labor, delivery, postpartum, so birth work. I've been blessed to learn from the original birth keepers, which I consider traditional and indigenous midwives. And so I've learned from them in Mexico, in Puerto Rico, and in the United States. So I'm able to layer in that type of care into an understanding of what the typical modern experience is. So I believe that preparing is key. I've literally rehabbed people from postpartum dysfunctions that have been a product of a lack of care. It's taken sometimes upwards of 2 years to help people recover. And I just really want to emphasize that it doesn't have to be the experience. We normalize so much that should not be normal. We normalize the pathologies that arise from a lack of care. So postpartum requires a lot of support. It requires a lot of space and a lot of understanding that there's so much that has to be integrated on top of, again, the physical body. So I am somebody who believes that we can bring back care sooner. We can implement systems and strategies to prevent things from being normalized, things like peeing your pants when you cough, sneeze, laugh, jump. I'm somebody who believes that, you don't have to live with wearing pads to manage your urinary leaks and your fecal smearing, that you don't have to deal with hemorrhoids for the rest of your life, that you don't have to experience back pain and sciatica forever. So I developed my holistic pregnancy as a way to bring in a lot of education and awareness during the pregnancy experience so that you have better outcomes during labor and delivery, and ideally have an experience postpartum that's one where there's a lot of support and there's a lot of care and there's just a lot of choice going into it. So if you want to join, it starts mid-October, and it's ideal for anyone that is giving birth between December 2020 and early 2021. So I would love to help guide, love to help support you if you are looking to have a pregnancy experience that is holistic minded and pelvic health focused and community oriented. This is it. So let me know if you want to join, and I look forward to helping you and guiding you through this transformative time. Take care.